Hi everyone, I'm excited to share that in 2 weeks I am heading to California for the ISHWSH meeting. ISHWSH is the International Society for the Study of Women's Sexual Health. I've never been to this conference and I've heard it's amazing, so I'm thrilled to be going and actually was super excited and honored to be asked to be a faculty member for an instructional course called Conversations with the Oncologist, and it's all about cancer and hormones. And the course is myself, Corinne Men, who all of you know, and if you don't, go follow her, and Sherry Goldfarb, who is a breast medical oncologist also with an interest in sexual health. So it's going to be a great conversation. We're going to talk everything from vaginal hormones to systemic hormones, and we'll share a lot here as well. But for this video, I wanted to talk about DHEA, or Intrarosa, which is the product that we can use for vaginal dryness, vaginal atrophy, genitourinary syndrome of menopause. So first of all, let's talk about what DHEA is. It is a hormone that is made primarily by the adrenal gland, and it is a precursor to estrogen and androgen production. Now, when DHEA is administered vaginally, it is converted into active forms of estrogen and testosterone, and it has been shown in multiple studies to lead to improvement in vaginal atrophy and really treating those symptoms without any meaningful increase in serum hormone concentrations of estrogen and testosterone. Testosterone is a vaginal suppository that contains DHEA, and that's a prescription medicine, and the brand name of that is Intrarosa. So let's talk about what we know about this in breast cancer. Most of what we know is based on a study called the NCCTG N10C1 Alliance study. This was a study that was published in 2018, and they had over 400 women, and they randomized them to either get a moisturizer, DHEA of 3.25 milligrams or 6.5 milligrams, and they administered this vaginal suppository nightly for 12 weeks. And they measured throughout the process, but at the 12-week mark, all patients, whether on a moisturizer or either one of the DHEA doses, had improvement in dryness and painful sex. Now, patients that were on DHEA had improvement in their vaginal tissue and a greater pH reduction, showing improvement in that atrophy of the tissue. And patients on the DHEA 6.5 milligram dose also reported significantly better sexual health on a questionnaire. And I think it's important to point out that we do see an improvement in symptoms with the moisturizer, and I will say I see that in clinical practice also. But the other part that's important is the changes in the vaginal tissue, because that can have benefit over the long run as well. Now, the question that comes up all the time is, well, what about absorption? Was there any systemic absorption of estrogen and testosterone? Phone died, but we are back. What they showed was that with vaginal DHEA, there was a slight increase in the hormone levels systemically, but they still remained in the lower half or quartile in the postmenopausal range. So that slight increase was not clinically significant. Then they looked to see what happened in hormone levels in patients on aromatase inhibitors, and there was no significant increase in either estradiol or estrone concentrations, which is really important. So we have this data that supports the use of vaginal DHEA, prasterone, brand name Intrarosa, in our patients with breast cancer. And this adds to the information and the knowledge we have about using vaginal hormones for the genitourinary syndrome of menopause in cancer survivors. Have you used Intrarosa? Let me know your thoughts, your experiences, your questions about all things vaginal hormones, and we can do a separate video on intravaginal testosterone if you would find that helpful.